Hey friend, in this video, I want to talk about actually how we're going to do a little bit of strengthening along with improving some flexibility of the shoulder girdle and the upper back. So the first thing you're going to do is actually sit up against the wall. You really want to find a wall that doesn't have any molding or baseboards. Sometimes patients have to actually close a door so they can sit up against something flat. So what you're going to do is actually put the bottom of your feet together, pull your feet in nice and tight, and then you're going to scoot yourself tight to the wall as much as you can. Now, here you should, but you want to try to feel that your lower back muscles are touching the wall, but you don't want to push your spine into the wall. So just have those lower back muscles relaxed up against the wall. You want your middle back touching the wall. Sometimes you kind of have to like pull those shoulders back and down a little bit to get to a good position, and then you want your head back against the wall. So this is very challenging just to hold this position for patients, because this is really like an ideal posture, but your body has been holding you in kind of that forward head posture, rounded upper back. So this is difficult to get into. It's just itself. If you find that very challenging, sometimes what you can do is just hold it and practice some belly breathing and drawing that lower belly, that belly button and just below it, drawing it into your spine, sandwiching that towards your spine to support your posture, and just do some nice deep belly breathing. And so this alone is going to help to relax a lot of those restrictions and activate your core in a very functional way. Now, if you don't have any kind of discomfort when you're sitting in this position, the next step is to put your arms up to the wall in this goal post position, okay? You should never experience any sharp pain at the top of the shoulders when you're doing this. So if you do, you really want to stop at that point. Okay, and so here you're going to find it even more difficult to hold that posture and those contact points to the wall. And so once you're able to hold here, if this is really too difficult for you, same thing. Next step up is hold this position with some deep belly breathing, really trying to draw that belly button in towards your spine to activate that deep core, that transverse abdominis. So the next step is now you can blow out and raise the arms up. Again, you should have absolutely no pain in the tops of your shoulders. What you will experience is probably some tightening, some muscle, little mini muscle spasms around your shoulder blades, which, I find a positive thing, that you're causing a little disruption to that faulty posture. You're making things work in a way that they haven't been. So you can blow out as you bring the elbows down. I like to try to bring them a little bit below the shoulder joint. And then I just do repetitions of this. Okay, so again, if you can decrease the range of motion if that's all that you can tolerate, and you should not have any pain. A side view of this exercise is really helpful for patients to see. So we're going to really scooch our feet, bottom of your feet together, scooch them in towards your thighs as much as you can comfortably without pain. Scoot your bum right up to the wall there, so those lower back muscles should be touching, that upper back should be touching, and now the back of our head. So this doesn't count. We don't want our neck sticking out. We want to really think about lengthening the back of our neck so that head can be in a nice neutral posture. Thinking about pulling that belly button into the spine. And if you can hold this comfortably while belly breathing, bring those arms up and start that motion. Okay, again, you should have no pain other than, some muscle reworking discomfort. If you do one set a day, about 15 reps, it should really make a big difference. Sometimes patients like to do one in the morning, set of 15, and then in the evening before bed, some stretching. Stretching will also, help you relax before you go to sleep. So if you have any questions, make sure you comment below.